let's talk about the complement system. Now this particular complement system, is an important component of killing up any of the microbes which comes in our body. So basically, what is complement? Complements are non-specific proteins. How much they constitute? 5% of the serum proteins. Remember, they are proteins. Heat labile they are at which temperature? 56 for 30 minutes. They will become inactivated at this particular temperature. They can bind to which portion of immunoglobulin? FC portion of IG. Immunoglobulin, if we take it Y-shaped fork, the down one is the FC portion. They attach to C for C complement. What are the sites of synthesis? The sites of synthesis is the GIT. Which particular complement is synthesized here? C1. Macrophages C2 to C4. Spleen C5 to C8. And for the liver, you remember C369. C369 is liver. And how to remember GIT? C1. That I stands for 1. Macrophages C2 to C4. Spleen C5 to C8. Liver 369. The multiples of 3. What are the various types of complement pathway? One is classical, one is alternate, and one is Lectin. Okay, basically it's an alternate one. Alternate pathway. What are the activators? Activators of classical pathway is antigen and antibody complex. I will tell you how it does it activate. Okay, which antibodies are involved of IgM and IgG both. Whereas the alternate complement pathway, or you can say fancily alternative complement pathway, these are the ones which are there: zymogen, endotoxin in the gram-negative bacteria, nephritic factors, proparidin. Okay, these particular names, they are the activators in the case of alternate complement pathway. Whereas in the Lectin, in the cell wall, they have a structure termed as what? MBL, mannose binding lectin. That is termed as what? MBL, mannose binding lectin. That is there as activator in the lectin pathway. And mostly it is present in whom? It is present in gram-negative bacilli. It is present in gram-negative bacilli. What are the activators of the classical pathway? The first complement which is involved up in this particular one is C1. Whereas in the alternate pathway, the story starts from C3 and the lectin starts from C4. This you need to know first of all. And in the starting, we already discussed up that the classical is a part of acquired immunity and rest of both, they are the part of innate immunity. Okay. Now let's have a quick recap of the classical complement system. In the classical complement system, just now told up, any antigen comes, which antibodies deals with it? One is IgM and one is IgG. They deals up with this particular one and they cause the activation. Which complement first? C1. Okay. And this particular C1 activation is further divided up into what? Q, R and S. This particular C1 is being cleaved up into 3 components, subunits, Q, R, S. Firstly Q, then R, then S. Okay. And this S is carry forward. C1S is being carried forward. What it will do? It will activate the C4, changes it into what? C4A, C4B. As a rule, this particular C4A is always discarded. Okay, this particular one, A component is always discarded, or in Hindi you can say alag. This particular one discards. Then what you have? You have this C14B. Okay, the carry forward is what? C14B. And this particular C14B will act upon which particular component? This particular complement, C2. Divide this into what? C2A and C2B. Now, here is an exception. Exception is, I have just told you the A component is discarded, but it is not discarded here. Which is discarded? This particular one. And this is an exception, which you should know. And now what it is? C14B2A. And this is termed as which convertase? C3 convertase. This is termed as which convertase, guys? C3 convertase. Now, if this is a C3 convertase, it will act upon what? C3. Okay. Divide this into what? C3A and C3B. As a rule, which is discarded? The A component discarded. What will carry forward? C14B, 2A, 3B. Yes or no? So that will be carried forward. And as you can see, this is C14B, 2A, 3B. And this is termed as C5 convertase. This is termed as what, guys? C5 convertase. And C5 convertase will act upon where? On the C5, divide into what? C5A, C5B, which is discarded. This one is discarded, which is carry forward, C5B. And the C5B 6789 is termed as what, guys? MAC. And what is MAC? Membrane attack complex. What it will do? It will put into the antigen some pores and all the cytoplasm will be out and it will be killed. That is what is termed as MAC induced killing. Okay, and this particular one attacks the antigen and kills it. Just the way I told you, the way it is there. So important is it starts from C1, first thing. Okay, and what is the sequence you have to remember? 142. And if you remember the sequence, it's very easy. 142 is the C3 convertase. C3 convertase is act on C3. Okay, and then the last one is C5 convertase, which is what? 1,4B, 2A. Okay, 1,4B, 2A, 3B. That is the C5 convertase, as you can see here. So this is the classical complement pathway. Now let's see the alternate complement pathway. The alternate complement pathway starts from C3. Okay, so which particular complements they are bypassed? 142. Okay, they are not consumed. This particular question comes that which particular complements are not consumed in alternate complement pathway. The answer is 142 because it starts from where? It starts from C3. Okay, so C3 is there activated by the various polysaccharides. Okay, I just told you all those activators, endotoxin, zymogen, nephritic factors. These all are what? Activators. Then this factor B comes into action, and what is being produced by is this C3 small b capital B. And this capital B is divided by which particular factor? Factor D. D, remember, divide. Divides into what? BA and BB. Like that. This particular B component divided into what? BA, capital B small a and capital B small b. It is divided by which factor? Factor D. Now, what is discarded? This is being discarded. A component is also discarded. This is there. C3 small b, capital B small b. If you remember this particular thing, that this is the C3 convertase of alternate complement pathway, your work is done. This is the C3 convertase of alternate complement pathway, your work is done. If it is C3 convertase, it will act upon where? C3, divide into what? C3 and C3b. Yes or no? And what is produced here? This thing. What is discarded? As a rule, 3A is discarded. What is there? C3 small b, capital B small b, and 3 small b. And this is what is termed as C5 convertase. This is what is termed as C5 convertase. And C5 convertase will act upon where? On the C5, divided into what? C5A and C5B. Divided into what? C5A and C5B. Now, as a rule, what is discarded? Again, this, which is carry forward, this one. And this is what is termed as MAC. This is what is termed as membrane attack complex. The thing is, it starts from C3. And what is the C3 convertase of it? The C3 convertase of this is C3 small b, capital B small b. If you remember this, then your work is done. Okay, what about the C5 convertase? C5 convertase is this. C3 small b, capital B small b, 3 small b. This is the C5 convertase. And its C5 convertase will act on which particular complement? C5. Yes or no? So this is the way to handle up the classical and alternate complement pathway. Let's talk about the Lectin one. The Lectin one is exactly similar to the classical complement pathway. Okay, it is similar to what? It is similar to the classical complement pathway, but only difference is it starts with C4. Then which particular complement is overlooked? C1. Okay, it is being asked then in Lectin pathway, which is not consumed? C1 is not consumed. Okay, C1 is not consumed in the Lectin pathway. Remember that. Okay, so this is important regarding the Lectin pathway. Now, certain roles of these complements, biological roles. First, it does what? Lysis of the target cell with the help of this MAC and all. Okay, chemotactic action is there by the C3A, C5A. Those which are going out of the cascade, they have some action. What? Chemotactic there. Anaphylactic, C3B is anaphylactic and which is termed as the best opsonin also. Okay, it's an opsonizer and plays an action of anaphylactic also. Mediate the type which hypersensitivity, guys? 2 and 3. And you know the 2 is which one? Cytotoxic, and 3 is which one? Immune complex mediated. And the fourth one is autoimmune diseases. Number of autoimmune diseases, complement does play a role. Endotoxic shock. You know endotoxins are involved in endotoxic shock also. The complement will be having some role. Now, deficiency of something like MAC deficiency, it leads to what? Recurrent Neisseria infections. This particular bacterial infection is common in which deficiency? In the MAC deficiency. Okay, that is membrane attack complex. And what is membrane attack complex, guys? C5 to C9 complements, they are absent, leads to recurrent Neisseria infections. H one of the components H, if it is absent, leads to what? HUS, hemolytic uremic syndrome, mostly happens in children. C1 esterase inhibitor deficiency means if the cascade 1 starts, it needs to be stopped also, no? So how does it start? With the help of the C1 esterase inhibitor. Okay, but that is deficient in some. So that will lead to what? Constant cascade. And that constant cascade will lead to what, guys? Hereditary angioneurotic edema. Hereditary angioneurotic edema. This is what is termed as C1 esterase inhibitor deficiency.